This is my infectious disease presentation. I'm doing the protozoan infections of Giardiasis and Amoebic Dysenteric. So Giardiasis affects the digestive system, specifically the small intestine. Here I have included its two forms, the trophozoite and the cyst, which we will get more into later. So introduction and etiology. Giardia infections are caused by the protozoan parasite Giardia duodenalis. Infection occurs through fecal-oral transmission. Transmission is through ingestion of cysts, and then once it is in your system, that's when it goes into the trophozoite form. It attaches to the intestines of people and animals and disrupts normal digestive process.
So pathogenesis. The life cycle of Giardia duodenalis consists of two stages. The cyst stage, which is the protective outer shell, and it allows Giardia to survive outside of the body for weeks or months. It also helps protect it from outside sources and different disinfectants. The trophozoite stage is the disease-causing form that's in the intestines. So once you swallow the cyst, the cyst passes through your stomach and excitation occurs. This is when it then goes into the trophozoite form. Then the trophozoite reaches the small intestine and replicates. The 8 flagella, which you can see here in my diagram, there's 4 pairs of them. They are what provide motility, and the ventral disc. And then the ventral disc, which is also labeled here on the diagram, that's what attaches to the intestinal wall. This is where it gains nutrients and interferes with the host nutrient absorption, including the absorptions of fats, carbohydrates, and other nutrients. And then they don't have an intracellular stage, meaning they live freely in the gut lumen and absorb nutrients from the host digestive process.
So before the parasite passes in the stool, they become cysts again. And then virulence factors. You have the ventral adhesion disc proteins. These proteins are crucial for the parasite's attachment to the intestinal epithelium. Then you have surface lectins. These molecules help the parasite adhere to the host cell and mediate interactions with the host intestinal lining. Variant-specific surface proteins, or VSPs, are highly variable proteins on the parasite's surface that allows it to invade the host immune system by constantly changing their surface antigens. Then you have cysteine proteases. These enzymes degrade host proteins, including mucin, tight junction proteins, and immunoglobulins, contributing to the parasite's ability to colonize the intestine and evade the immune response. Disease description. This affects mainly the small intestine. It does so by damaging the intestinal lining and impairing nutrient and fat absorption. Some people with Giardia infection never develop signs or symptoms, but they still carry this parasite and spread it to others through their stool. For those who do get sick, signs and symptoms usually appear about 1 to 3 weeks after exposure. Symptoms include watery, sometimes foul-smelling diarrhea, fatigue, stomach cramps, and bloating, gas, nausea, and weight loss. Signs and symptoms can last 2 to 6 weeks and can occur, but some people will say that they last longer and can keep reoccurring. The prognosis is generally good with Giardia infections. They usually clear up within a few weeks, but you may have intestinal problems long after the parasites are gone. Complications happen most often in children and immunocompromised. This can cause malnutrition, and then in some cases of children may affect growth and development. And then living with the disease can be physically and mentally draining while experiencing symptoms. Just because, you have diarrhea, bloating, it really affects your day-to-day life. Transmission. Giardia spreads easily. It doesn't take a lot for you to become infected. It really only takes the ingestion of a few cysts. And Giardia is found in the poop of people or animals who are infected. So anything that gets infected, contaminated water, food, surfaces, objects, or from one person to another, that's how it can spread. And then it affects 2% of the adults and 6 to 8% of children in developed countries. You can And then here you can see just this diagram here. You swallow the cyst, it travels through your digestive system into your intestine. That's where the trophozoites are released. Then they can replicate, and then eventually the trophozoites move back into cyst form, and then that's when they are passed. Treatment. Giardiasis usually clears up within a few weeks of symptoms. Several different drugs can be prescribed for severe symptoms. These are the antibiotics here that are usually prescribed. Prevention. Drug or vaccine that can prevent Giardia infection, but the best way is just to wash your hands, especially after using the toilet, changing diapers, or before eating or preparing food. It's also to avoid drinking untreated water, and you should always purify water you get just out in the wilderness. To always wash produce, try not to swallow outdoor waters like pools, lakes, rivers, and to practice safe sex.
Next, we have amoebic dysentery. This is another infection of the intestines. In this picture here is a trichome stain of the Amoeba histolytica trophozoites, which we will get more into later. Introduction and etiology. Amoebiasis is caused by the protozoan parasite Amoeba histolytica. It's found worldwide, especially in areas with poor sanitation or in tropical areas, and it exists, again, in two forms. The cyst, which is able to survive outside the body, and the trophozoite. And then here is a diagram of the two forms it takes, the trophozoite and the cyst.
Pathogenesis. It starts with ingesting the cyst through contaminated food or water, and then it then goes through the intestinal tract, and then the cell wall or the cyst is then digested and by the bile and the acid in the stomach, and then the trophozoite form is released. They then travel to the small intestine and migrate to the large intestine, where they can multiply or they can remain in the lumen.
So, virulence factors. The trophozoites adhere to the colonolic epithelium using specific lectin. And then here they secrete enzymes like cysteine proteases and amoebospores to destroy host cells and invade the intestinal wall. This triggers an inflammatory response with the release of cytokines and other inflammatory mediators, and then it causes inflammation and ulcers. This eventually leads to tissue damage, ultimately leading to symptoms like bloody diarrhea. And then trophozoites can also enter the bloodstream and spread to other organs, most commonly the liver, where they cause abscesses. Here you can see in this diagram how the matured cysts are ingested. It goes through the digestive tract, and then at one point it can split off to cause extraintestinal disease, and then if not, it continues along, takes back its cyst form, and is then passed through feces, and the cycle then starts over again.
Description. In this picture here, through the CDC website, this is amoebiasis caused by the parasite Amoeba histolytica, and this is seen in a magnified image. And then it primarily affects the large intestine. The colon wall and liver can also be infected. But once it affects the intestine, it can invade the colon wall in some cases, causing colitis, acute dysentery, or chronic diarrhea. And then signs and symptoms are bloody diarrhea, abdominal cramps and pain, fever and chills, weight loss and fatigue. And then if it travels through the bloodstream to the liver, it can cause liver abscesses. And then this the symptoms of this are caused by tenderness in the area over the liver. In very rare cases, it has the possibility of spreading to the lungs, brains, and other organs. And then the incubation period is usually about 1 to 4 weeks after exposure before you then start recognizing symptoms. It begins as mild gastrointestinal discomfort and then can progress to severe colitis or extraintestinal complications. And then only about 10 to 20 people affected become ill. Even then, symptoms are often mild, and they can last about 2 weeks. And then living with the disease, it can be same as with Giardia. It's just a bit uncomfortable. It causes gastrointestinal distress, dehydration, weakness, and then diarrhea, bloating. And then complications can be liver abscesses, side effects from medication, or just chronic infection. And then transmission. This occurs worldwide, especially in tropical areas or areas with poor sanitation. Amoebiasis is usually spread through fecal-oral route, so you're at higher risk if you engage in anal sex, live with other people in a place that has poor sanitary conditions, travel to places with poor sanitation, and then swallow something such as food or water contained with E. histolytica. And then if you put something in your mouth or swallow something that is unsanitary, it is also a risk factor. And then treatments. Amoebiasis treatments usually includes antibiotics. The treatments depends whether you're experiencing symptoms. One antibiotic will be taken if there are no symptoms. You'll be prescribed a second to take after you finish the first if you're still experiencing symptoms. And then afterwards, your stool will be continuously examined to make sure that you have been cleared of the infection. And then prevention. Be careful about what you eat or drink, especially when traveling to areas with poor sanitation. Common preventative methods are to boil filter water in areas with poor sanitation, practice good hand hygiene, wash produce thoroughly, avoid uncooked foods and street food in high-risk regions. And then the vaccines, there are none currently available. And then here is my first list of references, my second list of references.